You know, one of the greatest things about social media is that this is the first time in history that women in our age group actually have found each other.
Yeah.
And have started collectively saying, what's going on with my weight? What's going on with my joint pain? What's going on with my brain fog? And you don't feel alone. Of course, I knew that the hot flash was from menopause. I had no idea that the brain fog was menopausal. I had no idea that some of the joint pain was an issue. And I certainly knew that the sex drive lowering was part of what was going on. But I'll tell you, it was really when the belly fat and the back fat that I started to gain. And I was so demoralized because I'm the kind of person that exercises 6 days a week. I was doing everything I thought I was supposed to be doing. And even more so, I had stopped drinking during the week. So I had lowered my
alcohol
drinking significantly, and nothing was doing anything. My pants were not fitting. And it was so weird because I felt swollen all the time. And like, it's almost like certain parts of my body didn't change, but I just had this like tire around my center, and people would be like, well, but you're still really thin. I'm like, but that's not the point.
Right. That is where I put my toe in the water of all this menopause stuff. You were me. That is my exact story. We were living our lives, managing our stress, managing our weight, doing all the things. And then all of a sudden, you can't put your finger on it, but something's changed.
That's exactly what everybody says. And whether this is happening to you, or you've heard your sister or your mother or your partner say this, we start going, my pants are not fitting. I am grouchy. Suddenly I feel like I have ADHD or brain fog or dementia. I don't feel like myself in my body.
You are every single patient who comes to my office. This exact same story.
And I'm sharing this with you because if you're overwhelmed by the topic of hormone changes or menopause, or you're experiencing challenges with your monthly cycle, or maybe you're just tired. You're tired of hearing your mother or your significant other complain about the changes in her body. Boy, oh boy, are you about to learn a lot. One of the reasons why so many of you feel so powerless about your hormones is because your doctor is probably not informed about this topic either. So you're not getting the answers, the information, and the simple things that you can do that you deserve. Well, that changes today, because your friend Mel Robbins has tracked down one of the leading specialists on menopause and estrogen deficiency. She has hopped on a plane from Texas, and this woman is so busy. I cannot believe she's taken time out to be with you and me here in our studios in Boston. She has come to share with you everything that the research says, and more importantly, the simple things that you can do. And there's a lot that is going to surprise you today. For example, didn't know perimenopause can start as early as the age of 35. And, you know, I know that hot flashes and belly fat are symptoms of hormone changes. It's probably just the symptoms that I complain about the most. But current research is finding that things like ringing in your ears, frozen shoulder, I didn't even know that was a thing, dry skin, dry mouth, body odor, anxiety, fatigue, lack of a sex drive, autoimmune diseases, and on can all potentially be tied back to the changes your body is experiencing because of menopause. I am so honored for you to meet our expert today, because she's going to simplify this topic so that you no longer feel overwhelmed and left behind by the medical community, but rather you feel empowered and excited about what you can do. So let me tell you a little bit about Dr. Mary Claire Haver. So why is it that there is so little information about hormone changes and menopause? And you go to your doctor and it's sort of like, oh, well, you're going to deal with this for about 10 years. And then, you know, that's just the way that it is. What is up with this?
So if you go to PubMed, which is basically Google for healthcare professionals, which is where it's like a repository of medical studies, and you put in the word pregnancy, you'll get about 1.1 million articles, all important, great stuff, right? It's important that we have healthy pregnancies and we deliver children in a healthy way, and et cetera. When you put in the word menopause, we get 94,000 articles. we only get 10% of the funding. That means 10% of the brain power, 10% of the research for the last third of our lives. And, we do live a little bit longer than men, but we're going to spend 20% of that in poor health, in decline, in disability. And this is avoidable.
I hear the word menopause and I think out to pasture.
Right.
You're done.
And I thought that for a long time too. And then I'm Gen X. You know what? To hell with that. I want to live a good life. I want to feel like I can go to the gym. I can play with grandbabies. I can roll on the floor. I can climb a mountain. I can run a company. I can do all these things. And I'm refusing to just accept the medical definition of getting older for a woman, which is very different than a man's body. The endocrine system is where our hormones are created.
Okay.
All of our estradiol, our progesterone, and about at least half of our testosterone is created in those ovaries every single month, every single day. However, when we get to perimenopause, things start changing. And when we get to full menopause, we have no eggs left. The ovaries decline. We're losing our ovaries at the average age of 51. They stop producing sex hormones. And we basically are forced to live the last third of our lives without the benefit of estrogen, progesterone, and about half of our testosterone.
I get this at a level that I've never understood this before. Because when you really just put it in the context of you're born with a million eggs, and from the moment you start your menstrual cycle and the hormones are going up and down, there is a purpose associated with the design of your body. And once that stops, everything gets disrupted in your body. Oh, why has nobody studied this? What the hell?
People are studying it. When we look at OBGYN, the residency,
and that's what you
women's
are,
health.
right?
Yes, I'm OB-GYN, women's health. Super proud of what I learned in my training.
Right.
Pediatric gynecology, oncology, surgery, babies, fertility, all this stuff. Menopause got shoved in this tiny little box. Like, she's going to have a few hot flashes and maybe some vaginal dryness. Her bones might get a little weaker, and that's it. Oh, we only want to give her estrogen if she can't tolerate anything else. If nothing else is working, then fine, give it to her. But, you might kill her.
Wow. Wow.
Our bodies thrived on this hormone.
Right.
For 50 years, 51 years on
average.
average.
And by this hormone, you mean estrogen.
Estrogen.
Okay.
And testosterone and progesterone. We were living our lives, managing our stress, managing our weight, doing all the things. And then all of a sudden, you can't put your finger on it, but something's changed.
That's exactly what everybody says. And whether this is happening to you or you've heard your sister or your mother or your partner say this, we start going, I'm doing the same stuff I've always done. Like my pants are not fitting. I am grouchy. Suddenly I feel like I have ADHD or brain fog or dementia. I don't feel like myself in my body.
You are every single patient who comes to my office. Lack of estrogen is doing to each and every organ system. Each female has a unique expression of our menopause. So where you may have had palpitations, frozen shoulder, and dry vagina, I would have had hot flashes, night sweats, and horrible rage. And, doctors like a checklist of symptoms.
Yeah.
That's how we're trained to recall, but we're trained to look for ducks. How does it walk like a duck, talk like a duck? It's a duck. And everyone's duck's a little bit different.
You mentioned that every organ in a female body.
Yes. Every organ system, yeah.
Every organ system has receptors or has what for estrogen?
That's where the research is really exciting right now, is that Duke University did this elegant study looking at frozen shoulder, which is adhesive capsulitis, so common in women, especially in menopause. And a woman head of a orthopedic surgery department, talked to the woman head of an OB-GYN department at a big university, and they're like, something ain't right. And they did the studies and they showed that women on hormone therapy have a lower chance of frozen shoulder. They pulled all the data, and they're like, why would that be?
Why?
So then now they're going in and doing biopsies of all these joints and saying there's tons of estrogen receptors here. And when we lose that estrogen, we're seeing it's an anti-inflammatory hormone in the bones and joints. So we have arthralgias, joint pain, capsulitis, all of this stuff tremendously flares. And some of your listeners are like, oh my God, right now, I had frozen shoulder. So really, really common. Or hip pain or joint pain, or you can't roll over in the bed. it's so painful. And you have no injury.
Wait, I'm sitting here feeling one revelatory, oh my God, oh my God, oh my God. Like there are times in bed where I am laying there and I will go to roll over and it's as if I have to pry myself over. I'm so stiff. Wow. Mm-hmm. That makes so much sense, actually. So if the estrogen receptors are in your organ system, that then presumes that it's impacting liver function, kidney function, everything.
Lung function, heart function, brain function, genital urinary function, as we know, bones, osteoporosis we've known forever. That's a no-brainer.
Wow. And so I want you, as you're listening to Dr. Haver, to just really think about this for a second.
Estrogen's an anti-inflammatory hormone.
When you doctors say anti-inflammatory, I really don't know what you mean.
Sure.
And it seems like everything is inflammatory these days. And so you have such a freaking unbelievably cool way of explaining things. How would you describe anti-inflammatory, inflammatory?
Sure. So it's easiest to think about it in terms of acute and chronic inflammation. Okay. Acute inflammation, everybody knows. You got a virus. You twisted your ankle. You stepped on a nail. You know, it's the
I don't know what that means.
Body's response to an acute injury. So what happens? You breach some barrier in your body. A virus breaches it, you know, a nail, you twist your ankle, you have some orthopedic injury, you break a bone.
Okay.
Immediately, your immune system goes on alert.
Okay.
Make this stop. We need to fix it. So it rushes blood flow so things get red and swollen. It pumps fluid in the area to try to wall off whatever this invader is. Your white blood cells, which are in infection fighters and inflammation, those are all in pro-inflammatory cells in our bodies.
Is inflammation a code word in medicine for your body is in an alarm state trying to address something?
Yes.
Okay. I think I got it now.
And it's all the little biological processes that make that happen.
Yep.
So that's acute inflammation,
Got
right?
it.
We need that to stay
alive.
Break
a bone, boom, get to work. Inflame,
it hurts
inflame,
for a
go,
while,
go.
But then you're healed. Okay. Chronic inflammation is when that system gets turned on a little bit. It's kind of something's not right, but it won't shut off. So you have this chronic state of things being chewed up and laid down and you know, and estrogen kind of calms that process down.
I think I just got this. Let me see if I can explain this back to you. So chronic inflammation, which you said is this sort of like something's a little off, is that feeling where you're just like, something's not right in my body. Like I just don't feel comfortable in my body, but I don't know what it is.
And it can affect a joint, your whole body, your gut, your head, your whatever. You know, autoimmune disease is basically nonstop chronic and acute inflammation. So, and it can calm down a little bit. But what that inflammatory process does is chips away at our organ systems.
Well, what I'm also wondering is if the female body and intelligent design of the month is designed based on cycles of estrogen in particular, and estrogen gets removed either because of menopause or PCOS or changing issues or surgery or whatever, that something to your body's natural process every month
of
is
shutting
wrong,
down that inflammation.
and now your whole body's like, something's wrong.
Right.
We need some estrogen down there, and the body doesn't respond.
The ovaries can't do it again. They're done. There's a little part of the heart where it sends out a signal to control our heartbeat. It's called the SA node, sinoatrial node. That thing is super responsive to estrogen and likes estrogen and likes it, keeps it calm and like beating in a night thing. You take estrogen away, all of a sudden some women will start having palpitations out of nowhere.
Wow.
And they go to the cardiologist, they get their $1 million workup, and they're like, don't know what's going on. And we're not training the cardiologist to say this might be part of her menopausal picture. And when that estrogen level drops, we lose elasticity, we lose stretchability of the vagina, which might be helpful on occasion.
Is that why sex is painful sometimes?
For most women, they have atrophic area. So they've lost their elasticity.
Yep.
They can't make mucus anymore. The tissue is thin. If you look at a biopsy of premenopausal vagina, it's this thick, velvety, elastic, beautiful, like, bring it, baby.
Yes.
And then this postmenopausal woman who's never been treated, it looks like the Sahara Desert. You've lost layers and layers and layers of tissue. It's very dry. It's very small. And she's just gritting her teeth through sex.
And that is because
it's horribly uncomfortable.
entire...
I'm a hiker. And so I've got to use, even with, systemic estrogen, if I don't make sure that area is well moisturized,
Right.
things might, and also the architecture changes a little bit. So things are hanging at different levels. And so I love to hike. And so I'm going to have some chafing and things that I never had before.
Right.
I need to make sure I'm getting lubrication in that area.
Right.
So I can hike comfortably besides everything else I want to do in that area.
And this is
Preventable.
preventable.
Yeah. Now let's talk about how it can kill you. Recurrent UTIs. The bladder health, the urethra health, besides incontinence. The number one treatment for recurrent UTIs in a postmenopausal woman, the most effective treatment is vaginal estrogen, not chronic antibiotics. I'm going to save someone's life by this podcast because I'm going to keep someone from dying from urosepsis because she got vaginal estrogen after listening to this podcast. So medically, and I think this is a problem, menopause is defined as 1 day in your life, 1 year after your last menstrual cycle.
Yes.
Okay. Most women know that. Everything after that is postmenopause. So what's perimenopause? So perimenopause, the best I can define it is, remember, we're losing ovarian function our whole lives from the day we're born. However, there's a point in time when your body notices.
So you said that we have only 10% of our eggs
by
left
30.
By 30. So is that when it starts noticing?
So it depends on your body. It's when your body is like, something's not right. It could be mental challenges. It could be gut challenges. It could be inflammation in your joints. It could be irregular periods, heavy periods, light period, no period. It's really variable how it presents, but something has changed. Nothing in your world has changed. Something inside of you has changed.
Okay.
And so perimenopause is often defined by irregular periods, like in the medical journals, but it's a lot more than that. It's 7 to 10 years before your period stops. So 35 to 45, perimenopause is going to begin. You're going to start noticing something's not right. It could be the cliche symptoms of hot flashes. You know why hot flashes define menopause?
No.
Because you can't blame it on anything else.
Oh, that's
unless
true.
It's tuberculosis. Like nothing else causes a hot flash, pretty much, unless you have a fever, then menopause. So that's why it's the heart, the bell ringer of menopause.
But what other symptoms might you be experiencing?
Brain fog, arthralgias, frozen shoulder, joint pain, gut, constipation, diarrhea, you name the organ system, asthma flares, new asthma, new autoimmune disease, dry skin, dry eyes, dry vagina, dry mouth. It goes on and on and on.
So it would seem, based on the science here, that anytime a woman goes to the doctor and has any kind of complaint like that in terms of the symptom, that one of the standard procedures should be test her freaking hormones.
So that's another problem. The brain is pumping hormones as hard as it can.
Right.
And so in that perimenopause, I call it the zone of chaos.
Yes.
You're squeaking an egg out now and then, but you're having massive surges of that. We'll see estrogen levels like you were pregnant with triplets. 300, 400. They're temporary because you had to work so hard to get that egg out, and then it just plummets down to nothing.
Is this why our emotions are all over the place during the month?
That's what we think.
That makes perfect sense. Because if your system is in chaos, regardless of your age, by the way.
Right.
But if your system is in chaos because it's having to work so hard to just do the thing
to try
that it's
to do
supposed
the
to
basic biologic function.
No wonder you start to feel all sorts of things go haywire.
Mm-hmm. Right.
I would love to now focus on menopause.
Mm-hmm.
And are you still in a monthly cycle? Like, what is happening when you're in menopause?
So once those ovaries fail, and I know that term is harsh, but once the eggs are gone, no more periods. Any vaginal bleeding after menopause needs to be evaluated by a gynecologist. There might be something wrong. Okay. You should never have another period again. So your periods stop, or first they become shorter, longer. It could be anything, but eventually they just kind of stop. Some women will wake up and never have another period. Others will have this kind of skipping months and months between until they finally end.
Mine was like Chucky. Just kind of kept popping up, you know, like, oh, I thought you were gone.
Yeah, and here you are again.
Yes.
So once you've gone a year, then most scientists agree that you're done. Okay, if you're over the age of 45 and you hadn't had a period for a year, you are a postmenopausal woman. That's the clinical definition.
And what is the technical definition of when you've moved from perimenopause to menopause?
So menopause is that one day we're like, yep. It signifies your ovarian failure. You will never have another egg that's able to be fertilized again.
Okay.
The end. There's no more left.
Okay.
So, and then for the rest of your life, you're postmenopausal. Now, some of the symptoms you experience get better. It might take several years, like the hot flashes do tend to go away. The sleep disruptions, if they're related to hot flashes and night sweats, do tend to get better. It might take 7 to 10 years.
7 to 10 years?
So
I thought you said go away like, I'm thinking like a couple weeks.
It might take shorter, but I want to give people a very clear picture. And so a lot of women are like, well, I went through my menopause. Like, I'm done with that. And I'm like, your bones are still deteriorating. Your risk of cardiovascular disease is still increased. Like your genital urinary system without support is failing. And, these are the things that don't go away in your postmenopause.
When you think about the estrogen levels that you have at the age of 25, you only have 1% of that when
of estradiol, yeah.
You are postmenopausal. And the only sources for your body to create it are ovaries or...
And a little bit in the periphery, and other cells,
It.
That's it.
Wow.
And our march to death begins.
Not anymore, Dr. Haver, because you are here to make sure that does not happen, because we are capable of doing simple things to optimize our health and live a long and happy,
life,
juicy, amazing life.
Vibrant.
As a medical doctor, as a woman who is going through this right now, what do we do? Now that we know, what do we do?
Great question. So when I have patients come to me in clinic and we talk about menopause care, I do it in the form of a toolkit.
Okay.
We start with nutrition. We talk about movement and exercise. We talk about stress reduction, sleep optimization. Then we talk about pharmacologic options like hormone therapy, or if she's not a candidate, then other options for her based on her symptoms. We also talk about supplements that might be helpful.
Because there is this murmur out there that hormone replacement therapy
causes cancer.
Causes cancer, is
causes
super
heart
dangerous,
disease.
blah, bitty, blah, bitty, blah, bitty, blah. And you're saying there are certain categories where you should not be on. But for the vast majority of the women in your life, this is an option you need to be exploring.
Yes.
And it's not only safe, it actually increases your health outcomes. So the majority of us are a safe candidate for hormone replacement therapy. What about supplements? Like, what are the supplements that we need to take?
We really should try to get most of our nutrients from food. And we only supplement where there's a gap or you have an allergy and intolerance. And then we go in from there. There are a few supplements that are essential nutrients that might be helpful, like turmeric, right? That's not anything we have to eat to survive, but it has some pretty powerful antioxidant, anti-inflammatory properties, and that someone might find helpful. But when we're talking about the vital things, if I had my top 3 things I would recommend to everyone, fiber. Track your fiber for a couple of weeks. Get a nutrition tracker. See where you're at. Fiber does so much in our bodies. Number 1, feeds the gut microbiome. That's its food. So that's the prebiotic.
Give me an example of what fiber
legumes.
Is. Who?
Legumes. So beans.
Okay.
Beans. So it's a class of beans. Peanuts are actually legumes as well. Typically really high in fiber.
Okay.
Berries, really high in fiber. Seeds and nuts, really high in fiber. Those are kind of avocado, or, that's my go-to to make sure I'm getting my fiber goal every day. Also has healthy fats and other vitamins and minerals and nutrients. Magnesium.
And this confuses me because I'm not quite sure what type of magnesium to take.
Oh, great question. Your glycinates, your tarates, your citrates, and L-theranates are good because they're readily absorbed into the bloodstream. So now we have nice magnesium levels in our blood. There's also benefit. Some of them are better than others about crossing that blood-brain barrier. So the brain protects itself. There's a membrane around the brain that it doesn't have this 100% free flow of nutrients back and forth. It's really selective about what it lets in. So mag-L-threonate, which Magtine or Neuromag are the brand names, has been studied in like SSRI-resistant depression. So antidepressant, resistant depression in patients. They've added in this. It seemed to be helpful. And my patients, followers, it's so helpful for sleep, anxiety. So I'm often recommending that one at night.
What one was that one?
Magnesium L-threonate.
Okay, so you're saying fiber's number one, magnesium is number two. How do you get magnesium naturally?
So pumpkin seeds, spinach, green leafy greens are rich in mag generally. I have a lot of lists on my website where we list all this
We will
stuff.
link to all this. And what's the third thing?
So I'm always looking at omega-3 fatty acids. Omegas are usually found in fatty fish, also in flax. One of my favorite ways, I'll do this little yogurt and I'll have flax, hemp, and chia seeds. So I'm just hitting all my antioxidants, my anti-inflammatory, my fiber all in one. So omega-3s, if you can't get a good source of that, that's a very reasonable thing to supplement every day. One of the richest sources of that is going to be your salmon, your mackerel, your tuna, your fatty fish, your cold water fish. And then I check a vitamin D level on every woman who'll let me stick a needle in her. 80% of my patients, not just low, I mean deficient. And there's a million reasons for this. We don't absorb it very well because our gut health declines. We're protecting our skin from the sun, which is another place. And we're not really creating it in our skin as fast as we used to. So, and vitamin D is a hormone that has a million, processes in the body. So I'm like, let's start here and get those vitamin D levels up because you're just not working as efficiently as you could.
So if you are eating the fiber and the magnesium and the omega-3s, and you're also taking the vitamin D supplement, how do you make sure that your body can actually absorb it or that your gut health is okay? Like, do you also recommend that people take a probiotic?
So I do. They've done some studies looking at probiotic supplementation in women with obesity and hypertension who are also postmenopausal. And there were some really positive results of, it's hard to measure gut health. We don't walk around with stool samples and they're counting the microbes in it. But when you're bloated, when you're having regular bowel movements, how you feel. When we go through menopause and lose our estrogen, the gut microbiome loses diversity. No matter how many probiotics you take or, there are things we can do, workarounds. But the loss of estrogen will change your gut microbiome to the profile of a man's.
Is that why we get a belly?
Part of it. That's part of it. So we know that an independent risk factor for visceral fat deposition, what we call belly fat in layman's terms, visceral fat means inside wrapping around the organs, inside the abdomen. That fat is very different than the curvy fat, than subcutaneous fat. That visceral fat is a marker for cardiovascular disease, diabetes, stroke. And so women who were on the probiotic versus placebo had lower blood pressure and lower visceral fat. Weights didn't change. Calories are still important, but they're not the only thing. But their visceral fat levels went down. So for that reason, I'm like, eat something rich in a probiotic every day. Yogurt, miso, kimchi, whatever floats your boat. If you can't tolerate that, then you want to consider supplementing.
Gotcha.
What I tell my children all the time, we need to move our bodies to be strong, not skinny. And that we are chipping away this constant caloric restriction and all this cardio is chipping away at our bone and muscle strength, which we are going to desperately need as we age, especially if you're built like me.
Yeah.
And I didn't pick up weights until I was well into my 40s. And there's never too late. Anybody listening at any age can start weight training. And you should. So I think that getting people to let go of this notion that thin is the way to be and that you're way better off having a little more curves and a lot more muscle is going to serve you in these menopausal years so much better than just being skinny.
I have followed all this advice and I have switched up the entire way I approach exercise. I now resistance train 3 days a week.
Look at why you're having a hard time. Progesterone goes a long way to helping us sleep. And so estrogen leads to hot flashes and night sweats, which are completely sleep disruptive. I mean, even with hormone therapy, I still have a thermometer leg that I have to throw out occasionally.
A thermometer leg.
So
I was just talking to a friend this morning. She's like, oh, well, I just stick my leg out and the fan hits it. And that's how I cool myself down.
Yeah. And then you just throw it back in, throw it out, throw it back in. So I'm like, okay, let's get you on some estrogen.
Okay.
You know, and so say she's had a hysterectomy and she doesn't have to have progesterone. Progesterone's an option. So I'm like, you know, people sleep deeper. It has an anxiolytic effect.
What does that word
So
mean?
Anti-anxiety.
Anti-anxiolytic effect? Wow, that was
anti-anxiety effect.
Okay.
So if your sleep disruption is also you're having racing thoughts at night, you can't shut that brain off.
Yes. This is my daughter.
Progesterone is beautiful for these women, especially in perimenopause when we're skipping ovulations and we're not giving that monthly surge of progesterone.
Is this an option for somebody who's even before perimenopause?
Perimenopause. You could, yeah. Yeah,
Wow.
you can safely take progesterone every day, even if you're premenopausal.
Wow.
It can be really helpful.
Wow. All right.
So estrogen, progesterone, but also sleep hygiene. We can't negate the fact that we're on our phones too much at night, the blue light, not setting up an environment for good sleep, a snoring partner, especially some of it, you know, and all the things we need to do to set ourselves up for success for sleep. And then when you sprinkle in the hormone changes, it's a disaster for some women. And that's really something I zero in on.
What do we need to know about alcohol?
I don't know any woman who's in her menopausal journey who is processing alcohol the way she used to. The tolerance seems to be going down. I'm excited to see some more research come out about this. But in my world, like I have to go in my personal experience, if I'm choosing to have a drink, I am choosing not to sleep. I'm going to be up at 3, 2:32, 3:31, whatever it is. And it is like a bomb going off, even one glass. And I have to make that choice. I can't drink like I used to, thank God. You know, those college days. Most of the women in my practice and on social media are commenting. Every time I talk about it, they're like, yep, gave it up. It's not worth it.
If you're choosing to drink, you're choosing not to sleep. It really is that simple.
Yeah.
Wow.
My husband was like, he was going on a trip. I said, when you get back, you're going to have the wife you deserve. I'm going to get this fat under control. And he was like, I love you. I think you're beautiful. Your girls are watching this behavior. And he said, you're a smart girl. Figure this out. You're a scientist. And he got on the plane. And I took that as, you know, I'm going to figure this out. That I called the PhD nutritionist at the university I was employed at. I was like, what the hell is going on in menopause? Because my patients can't lose it. I'm struggling. I'm starving myself. I'm working out all the time. They're like, yeah, there's something going on in menopause. We think it has to do with inflammation. Read all these articles. And hence began the rabbit trail for me.
Yes.
Of going down, well, the rabbit hole. And I was like, whoa, inflammation, estrogen, visceral fat. What is this visceral fat thing? No one ever taught me that in school. Whoa, my diabetes risk. Let me check my cholesterol. Holy shit, it's elevated. Like, oh my God. And then that's why I wrote the book, to put it all together.
So for the person listening, I know what they're now thinking. Okay, great. I got to get the book, but how do I find my own Dr. Haver? Like how do you, I'm dead serious about this.
Right.
How do you prepare yourself to go in to your doctor? And how do you find somebody who has been studying menopause?
Right. So in a perfect world, you could just march into your PCP or your OBGYN even, and they would be like, absolutely, let's go. We're probably a generation away from this becoming normal. So what can you do now? I have a list on my website of testimonials from my followers who have found great people. So that's one place. The Menopause Society, of which I've become certified, is an independent organization of people who care about menopause, do research in menopause, and they have a certification and training program. And so you can find at the Menopause Society or menopause.org, go on there and find a certified provider. That's another place to start. Some of the new telemedicine companies coming out are built to serve the menopausal woman. I don't love it as much as an in-person visit because I do in-person visits, but my God, that's all they do is sit there, listen to your symptoms, believe you, order a test if you need them, and give you the hormone therapy you so desperately need.
I will link to absolutely everything that you've recommended, including how to find you, find the book, and reach out to you in all the resources for this show.
Awesome.
Do you have any final words of wisdom to the person listening?
You know, you're not crazy. It's okay. Find a community, talk about this, share this with everyone. We need to normalize this before we can optimize it. And that don't let your daughters suffer. Tell them about your own experience because they're most likely going to mimic what you've gone through. Menopause is inevitable. It's not a bad thing. It is a natural process, but you don't have to suffer. What I love about menopause is women find this power to put themselves first for the first time in their adult lives. Their give a shit factor goes away. They don't care anymore. They are embracing who they are. And I love that about us. You know, I'm more successful. I never could have done this in my 30s, you know, that what I've been able to build. And I just love that about this age, but I want to keep that going.
Dr. Haver, I just want to tell you, you are a gift. I am so thrilled that you took the time to be here. I do think you are changing and saving people's lives. I hope as you've listened to her that you've not only learned a lot about your own body, but that you feel more empowered and that you have a few very simple things that you can start doing immediately. And I hope one of the things that you do is that you take a moment to share this with every woman that you know. And I'm not just talking the women that are peri or postmenopausal. I'm talking every woman in your life, because the information today was about the design of the female body and about how estrogen and estrogen decline and deficiency impacts her profoundly. And so this really could change somebody that you care about. It could change your life. So thank you.